Hello, I'm Aaron Blank, President and CEO of the Fury Group, and I'm here at the Life Science Innovation Northwest Conference in Seattle at the put on by the WBBA, which is our biotech and biomedical science device industry association. I'm here with Tom Walker. Tom is just our friend, our neighbor to the north in Vancouver, and he's with LGT Medical. He's the president and CEO of that. Welcome.
Thank you. Yeah. Pleasure to be here, Aaron.
So tell me a little bit about LGT Medical and what this device is that we are looking at here and what's on my finger.
So let me go back a little bit. This is all stemmed out of research from the University of British Columbia. There's some real thought-leading research going on in there associated with the developing world and saving lives as it relates to children with pneumonia, childhood pneumonia, as well as pre-eclampsia in pregnant women. These are two big killers in the developing world. For example, 1.1 million children under the age of 5 die of pneumonia every year. If you think about that in terms of something that we could understand, that's the equivalent of finding that Malaysia plane, filling it with children, and crashing it into the earth 11 times every day. That's the silent death that's occurring as it relates to pneumonia. Now, these researchers reasoned that if we could get diagnosis, treatment and diagnosis out into the community, rather than just in the hospitals in developing world countries, that treatment and diagnosis could occur much earlier and therefore save many, many lives. The way they reason doing that is with applications that predict whether the child has pneumonia, for example. And what they needed to fill in the data, in addition to the symptoms, was vital signs monitoring. So they needed to get at things like oximetry, which we're showing you here, which non-invasively shines light through your finger and gives your oxygen saturation, which we can see there is 97%. What that's telling us is that 97% of the hemoglobin molecules in your blood have an oxygen molecule bound to them. So you're fairly healthy, which is a good sign. Having said that, if it was much lower, it could be supportive of a diagnosis of pneumonia. As a consequence, the challenge with these issues is that vital signs monitoring is often very expensive and has been a big barrier to entry in the developing world. So what the researchers reasoned was, if we could use the audio port, universal to almost every mobile device, and connect directly in and drive the sensor from the power that comes out of the audio port, which it's doing now, and delivering the information back into the device where it then gets processed by a simple downloadable application, then we could strip all the costs out of the oximeter itself. And at scale, we'll be able to build this device for $5.
Wow.
What's interesting about that is I used to work for Physio Control, a company here in Redmond, Washington. And back in the late 80s, I was selling oximeters for several $1,000s a piece. And now we've been able to drive it down. And this is an example of how mobile health can really, really make a difference in the developing world. Now, if I can take it a step further, fill in the story, the biggest challenge is that to be able to deliver something like this, you have to figure out a way to afford to build the company. And the challenge there relates specifically to how do you scale a company like this and describe to potential investors that it's a sustainable business. And that's where the big challenge lies in anything associated with health inequities. Think about health inequities for a minute. In the reason why health inequities exist in the world, Bill Gates would say, is because there's no market-driven method of fixing it. It's very complex, and so philanthropic organizations try to support doing that, but that's not sustainable. In this particular case, this is a perfect example of reverse innovation. And what that means is that the researchers at the University of British Columbia went out to resolve a problem in the developing world and have created an ultra-low-cost way of doing remote patient monitoring and home monitoring, which is ideal for American and high-income markets that no longer can afford and sustain healthcare the way we've been managing it lately.
Tom, fast forward 5 years from now. What's this product going to do for the industry and where we're at?
It's a good question. It's the connectivity that's really our business. And so we want to make this connectivity available to anybody and everybody who wants it at no charge. What we're looking for is that connectivity bonds to our sensors. So our business is around selling the sensors into our connectivity. But fast forward, what this does is it takes the remote patient monitoring logic and it it just spins it on its ear, because the reality is with this kind of device, we're eliminating, for example, a blood pressure monitor, which we have a prototype of and are making for about $1.75 plus the price of the cuff. So it's really going to change the dynamics of being able to walk into Walmart and purchase a blood pressure monitor that works with your phone for perhaps as low as $9.95.
Wow, amazing. In terms of Life Science Innovation Northwest, we're here at a conference, there's 1,000 people. You've obviously invested and decided this is worthwhile. Why are you here?
Well, we want to get the word out. We've worked for a number of years now and worked with a number of foundations, including the Gates Foundation, as well as CRAN Challenges Canada, which is part of the government of Canada. We've been building an innovative business model that says that if we can get foundation sponsorship and to support us to scale, as well as typical ROI and venture capital investors, we're creating a hybrid business model, as we say, a socially driven business. And what that really does is that creates an avenue whereby we will be a sustainable, very profitable business with the #1 target of saving women and children around the world in some of these lower income markets. Almost an interesting way of for-profit philanthropy, if you will.
Amazing, amazing stuff. Now, you've had an illustrious career. You've worked for Eli Lilly, Physio Control, Cardinal Health, AGFA Healthcare. I mean, you've been around. Mm-hmm. There's many people in our community that are just starting off in their careers. What would you give them as advice for where you are? What is something that you would have wished you had known back then?
Well, I'm not sure if I can give advice simply because the world has changed so much. I think the most important advice I can give now that I'm more in the early stage is that there's a lot to entrepreneurship. And it's very, very important, particularly for people that are actually fundamentally innovators and researchers, that as they think about how they're taking their product to scale, they don't necessarily imagine that they can do it themselves, that they can understand the underpinnings of commercialization. It's very important to get good support from people that have done this before. So the complexity of technology transfer, for instance, is an important hurdle to look at very closely.
Wow, amazing. Tom, you guys are up to some amazing things and some great innovations that's coming out of your shop. Thank you for your time today. I look forward to learning a lot more about you.
My pleasure. Yeah. Thank you.